Hey, what's up, guys? In this clip, we are going to go through a exposure. So we're going to talk about what is an exposure for COVID-19 for fire and law enforcement personnel. As a standard disclaimer, this document and the recommendations in it do update and change regularly, so please make sure you are checking the current version. You can go to bit.ly/COVID911, or if you've got a smartphone, just hold your camera over this little QR code and it's going to pop up a link to the most current version of this document. All right, so if we think we may have an exposure, what are our first steps? All right, so if there's any doubt of a potential exposure, you should put a mask on, wash your hands, and isolate yourself. All right, that doesn't mean that it was an exposure or that it's going to count as an exposure, but that's going to be the number one safest step we can do. So for your own sake, you want to put a mask on and wash your hands. Washing your hands without touching anything else is really, really important. That's going to be, again, your number one protection. And then isolate yourself. You don't want to get too close to others. Now, this being said, do keep in mind that if you truly did have an exposure and contracted this virus, it's not like you become immediately contagious with it. So it's really more the concern of what is on you or on your clothing and the exposure that you had getting onto others. So don't feel like as soon as somebody coughs or sneezes on you that you like magically become infectious all of a sudden. Right now, they're thinking that's about 3 days for the average person when you actually become infectious and start shedding that virus to others. So that's not the big concern. The big concern is just what has maybe got on you. So that's why you want to decontaminate yourself as best you can and prevent anyone else from getting contaminated. All right, then we want to evaluate the simple exposure using the guide and this frequently asked questions. And also you can always talk to your supervisor, talk to your infection control person, talk to whoever at your agency is kind of designated to handle these things. If you don't have such a person, you can call the health department everywhere in our area. Health departments have different hotlines and contact numbers and things. So hopefully there is someone set up at your agency to do that. But if not, you can always reach out to a medical professional, your own primary care doctor, or the local health department, and they should be able to provide you some assistance there. All right, next we're going to evaluate the risk. So we have a possible exposure. We want to figure out how much at risk am I? All right, because there's always a little bit of risk in everything we do. But, even just walking down the street or, going to the store, there's at least some kind of standard low risk that we run. All right, so if we have an exposure and we want to evaluate that, we're really combining two different factors here: how much protection you had and what the subject that you're dealing with had. And we're going to balance those two things out to figure out what kind of risk is involved. All right, so first off, talking about you and what kind of protections you had. All right, if the responder had no mask on and the person we suspected of anything, so they have any of those symptoms: fever, cough, sore throat, dispatch tells us they might be at risk, EMS or healthcare provider tells us that, and we were not wearing a mask, it is automatically a medium to high risk. All right, no matter what you do. So if you look at that, if you're not wearing a mask, you're pretty much at a medium to high risk anytime you interact with someone that might have COVID-19. So a mask is really, really important. All right, and really whether or not the person was coughing or they were wearing a mask or not, or whatever happened, you're still going to have a high risk here. So we want to try and get that source tested. We want to get the person that you got exposed from tested, because the difference in whether or not we get them tested is going to mean, do we need to keep you out of the game for like 14 days to make sure that you don't get sick? Or can we test them, make sure that they don't have it, and as long as their tests come back negative, then you can go back to work and get back into the fight. So, we do want to recognize these high risk or medium risk exposures, and we want to recognize them quickly so that we can get that source patient tested if at all possible. All right. Next option. So as the responder, you are wearing a mask, but not any kind of goggles or eye protection. All right. So this is something I see even like watching the news. You see people at these test sites walking around swabbing people and testing them, but they're not wearing any kind of eye protection. So if you had a mask but no goggles, if the person gets fluids or coughs on you, that's a medium or high risk, and we want to get them tested. If the person was not wearing a mask, so we didn't put a mask on the person that we're dealing with, and you had an extended interaction with them or an extended potential exposure, again, that's a medium to high risk, and we want to get them tested. If you were wearing a mask and we put a mask on them, then you're good. That's a low risk. We don't need to do anything, just standard decon. So washing hands, wiping things down. So as long as you are wearing a mask and they are wearing a mask and they don't cough on you or anything like that, then that is low risk. You don't need to do anything special. All right. What if you, as the provider or the responder, are wearing both a mask and goggles or eye protection? All right. If you look across that bottom line, as long as you are wearing your mask and goggles, the worst case here is a low exposure risk. So wearing your own protective equipment is really important here. All right. So even if they coughed on you or got fluids on you, if you're wearing a mask and goggles, that's a low risk. We still want to wash our hands, remove our gloves. We want to wipe everything down in our standard decon. The only added step here is if they actually got fluids or coughed on you, then you're also going to want to shower and change your clothes, because if it got on your clothes, you don't want it staying on there, right? If you're wearing a mask and gloves and the subject is not, that's still a low risk. So as long as you have your mask and your goggles on, then that is considered low risk for you, whether or not they were wearing a mask. Obviously, we still want to wear them, give them a mask to wear, because that's going to lower the risk even more. So that is kind of that bottom right corner there. If the responder was wearing the mask and goggles and the subject put on a mask as soon as possible, that's about the lowest risk exposure that we could have. No special follow-up is needed. We just need to do standard decon, hand washing, wipe everything down. If they got in your vehicle, just open up everything and let it air out. All right, so what do we do if we had a medium or high risk exposure? All right, so we have a potential medium to high risk exposure. Number one is still going to be to decon. So we want to shower and change and get out of any of that stuff that we had on us. We can scrub any exposed skin, and any of our clothing that got exposed that has obvious fluids or anything on it needs to be washed. So you don't want to keep wearing that. Next, we want to inform our designated control officer, whoever that is, whether that's a supervisor or a medical authority or the health department or whoever. Contact who you're supposed to contact. And then a big thing is we want to get that source patient tested. So they're not going to know that necessarily unless you tell them. If they go to the hospital, for example, they may not meet normal testing criteria. And if you don't tell them that there was an exposure and that's why we need to get them tested, they may not get tested. And if that's the case, you're going to be out of the game for right now, they're recommending 14 days until we can make sure that you don't develop any kind of symptoms. So if we can get them tested, sometimes we can get those tests back in just a few days. Even right now, some places are already doing rapid testing, which they can find out that same day. And that's going to really make a difference as to how long or how quick you can get back in and help. All right, so we want to check that. And then the last step here, if we have a high risk thing, it's probably the best thing initially to go home and self-monitor. We want to minimize the risk to others. This means you can go home and shower and change clothes and do all that. Even if the source is positive, then, still same thing. That rushing yourself off to the hospital is not going to do anything. We really don't need to test you, especially right now. The best a test is going to do is on you is tell us in a couple days whether or not you develop it. So they're not going to test you right away anyway. And even if the person was positive, unless they're testing you to try and get you back in the game, then testing you isn't really going to change anything because it doesn't affect the treatments or what we can do or not do for you. Most of the treatments, it's just supportive right now. So getting you tested is not a big deal. You just want to be home and isolate. All right, so what does this home self-monitoring thing actually mean? All right, chances are everything is still going to be okay for you, so don't freak out. The chances of you actually contracting this from the exposure are still relatively low. They're higher than we want, which is why we're going to use our PPE and decon ourselves. But the chances are still relatively low, but we want to make sure that we are taking precautions. So we go home and we are not working until either we find out that the source is negative or after 2 weeks, if the source was positive. So they tested the source or they couldn't test them. And we wait that full 14 days to make sure that we don't get sick. All right. If during that time we do develop a fever, cough, or any other symptoms, then we want to contact our family doctor and just let them know. They're right now most likely going to not recommend testing for you unless you get really sick. They're going to probably just tell you to stay home and isolate. And you want to make sure that you're reporting that back to your supervisor or your designated person at your office or where you work so that they can follow up with that on their end. All right. The couple other little clarifying details here. So let's see. As far as cough, so where we were talking in number 1 up here where the fluids get on you or they cough on you, if they're wearing a mask, that's okay if they're coughing. All right, so the mask is intended to catch any of those particles. So if they are coughing inside their mask, that's okay. That doesn't fall into that high risk category. All right. The risk of no mask only really applies to prolonged close contacts. So if you believe that somebody has some risk factors, but you just kind of walk in the room, decide that, and immediately leave, that's not considered a prolonged close contact. So if you're with that person for several minutes and it's an ongoing thing, that's a little different. But very brief interactions doesn't really matter whether or not they have the mask on. At that point, it's still considered low risk if it's very brief. All right. Talking about decon, again, scrub any exposed skin and launder any clothing that is obviously soiled. We mentioned that. And even if the source comes back positive, your individual risk is still relatively low and your risk to others is even lower. So even if you did have an exposure, it's going to take up to 3 days before you become potentially infectious. And, as long as you're taking the right precautions and isolating yourself, then you're very low risk to others. So that should help calm any concerns there. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.